Dr. Sanchez, how do shared medical appointments work?
Shared medical appointments are an innovative delivery healthcare model in which patients with chronic conditions receive education to manage their condition. And what typically happens is in the traditional encounter with a healthcare provider, patients are allotted 50 minutes to give medical attention and education concerning their chronic condition. And so shared medical appointments provide an opportunity by which a large group of patients can receive the same information all at once to save the provider time from having to repeat the same information multiple times during a day to multiple patients.
And what's been your experience?
My experience with shared medical appointments has been a positive one. We have seen an increase in patient satisfaction, decrease in complications, improvement in A1C, lipids, blood pressure. It has been a clinical significance, not necessarily a clinically statistical significance, but a clinical significance for the patients.
And how does a provider get paid for this service?
Providers, including physicians, nurse practitioner, clinical nurse specialists, and physician assistants are reimbursed using the CMS Evaluation and Management Code, which for a new patient would be anywhere from 99201 to 205, or for an established patient, 99211, 99212, 99213, 99214, or 99215.
And what are your next steps?
The next steps that we have for our practice now that we are conducting shared medical appointments is to apply for American Association of Diabetes Education and Accreditation, and therefore bill for the diabetes education separately using the G codes. And only accredited organizations can use G codes and get additional reimbursement for the diabetes education that they provide.
What advice would you give physicians who are interested in this model?
My advice is make sure you do your research, have a process in place that works for your practice. Make sure you get buy-in from your staff, buy-in from your patients. Once you understand how shared medical appointments work and you get them going, they're very easy to conduct. You'll see an increase in your patient satisfaction and sometimes even an increase in the patients that you get into your practice.